Breaking news, but this is good breaking news. I haven't done a research update like this in a while, and there's a couple different things I want to share with you in the landscape of HIE research. So first up today is related to registry and data collection, looking at the different causes of HIE. This one is really important, I know, to our families where HIE was avoidable. And so this is a group out of the UK that is looking at improving their data collection on those avoidable cases and reviewing the current data dictionaries that they use within the UK system, and then consulting on that on how to improve that. And so one of the things that we're doing with the HIE registry is we have been working with the Newborn Brain Society. Dr. Eric Peoples, who works us with the registry on the HIE CPRN side, is the one that has really spearheaded a group effort on finding the common data elements that should be used in an HIE registry from the existing registries out in the world, and analyzing and working with a big group of people to formulate a consensus on looking at what people collect and what we can agree upon to all collect moving forward. And that data does include maternal data and pre-hospital data, pre-NICU data. So this is really important. And immediately I sent this to Dr. Peoples and Dr. Barber, because I was really excited and wondered if we could, see if we had the similar elements, and we do have the majority overlap, which means that the data will be able to harmonize at some point, which is really exciting. So speaking of causation, this actually published in August, but there is a wonderful, more layperson summary of this in the what they found and the implications of it that's available on our Facebook page right now. But I'm going to build a blog off of all these to be easily found at hopeforhie.org/blog after this. But this is important, and this was from the HEAL study data. So we have a ton of the HEAL study families in our community. And while the HEAL study hypothesis didn't pan out with testing, cooling, and EPO, which is a type of medication, the secondary analyses that have come out of the data collection, because the data collection was so robust and good, have been incredible to see. So for the families that enroll in these clinical trials, it's so important because this data improves the knowledge we have about HIE. Every single study that comes out is something new that wasn't known before. So in particular for this one, this looks at how many babies have a dual diagnosis of stroke and HIE. And in the cohort study, it was 4%. But the most severe kids that had the comorbidity or the co-occurring conditions had more severe outcomes. So that was really interesting as a takeaway. And this can also really help researchers dive in to see what therapies might work better for some than others as we get in more of this precision medicine approach and looking at how we can, kind of figure out the best way to optimize these therapies for to be their most effective. So on the note of the HEAL study, this is another one that published. The lead author is Dr. Hannah Glass. She is an amazing collaborator with us. She's on our medical advisory board. She's one of the co-principal investigators of the neonatal seizure registry, which we talk about all the time. And this is another secondary analysis out of the HEAL study that looks at creating a better predictive model of what 2-year outcomes are for predicting death or severe disability. So the study that I just showed you, the raw one, is not very patient family friendly, but this one is, and this one really breaks down the article and what is most meaningful to patient families. So one of the key takeaways was, we have communicated to our medical advisory board and had many conversations with Dr. Glass and others about the expressed lived experience of our community, and especially for those families that may get a prognosis that's not accurate. So either way. And this is also something that is very troubling to physicians. They don't want to be wrong. They don't want to give people an inaccurate diagnosis or prognosis. They, don't want to. It's very uncomfortable for everyone to talk about the unknown with HIE. And so they want to get better and better and better about counseling. So this is one way to do it. So this is really only looking at outcomes to 2, so it's not predictive of how a child will be in school age. Will they have learning disabilities? Will they have behavioral concerns, epilepsy onset, all of that stuff? They don't know that. But in this study, in the predictive model that they looked at, less than 2% of the predictions for severe outcomes were incorrect. So 98% of the time, they were able to accurately predict and counsel families about this prediction for death or severe disability. So last, and the most important, I think, we have new research news. This we shared actually a year ago about Dr. P.M. Wintermark publishing this study looking at the feasibility and safety of Sildenafil, which is also known as Viagra, in the repair of brain damage with HIE. So obviously, those are big words, and those are big aspirations for anything. And I think our whole community would be thrilled if this pans out. But how science works is you take something and a concept and see if it's feasible to do in a clinical setting and see if it's safe. Sildenafil is already used in other indications for babies, for pulmonary hypertension, for example. And so we already have the safety profile that it's used. Used for this purpose, it has not been studied. So Dr. Wintermark has been doing this work. The one single center she got great data from, but we don't know if it's actually effective until you get a bigger cohort. And that's why people do multi-center studies and why you want to get a lot of babies enrolled. Hope for HIE is partnering on this study. Really, really excited. And it's been an up and down process to have a front row seat to the process of these applications that go in for these big funding awards to fund this research. And so got the email yesterday from Dr. Wintermark. I cried. I was very excited because we just need some good news for our community. And so this is really exciting that this will be moving to a multi-center clinical trial. So again, this is going to be on our blog with links and all of that. But really, really exciting news because we need more. We need more things across the spectrum to improve the quality of life for our kids, to decrease the incidence of HIE, and all of these things are working towards that.